Today, we are going to simplify the healthcare debate. I know that there's a lot of confusion. I think that a lot of the people writing about it and discussing it themselves don't even fully understand it. I actually spoke at length with a healthcare lawyer to clarify all these things, and today I'm going to break it down as simply as possible and in as short a time as possible. I literally just drank gulped down this entire high-octane drink. I'm not exaggerating, because the only way to talk about the healthcare debate is to have this stuff loaded up into your system. Going to explain Obamacare, what it essentially was trying to accomplish, how it accomplished it, at least the key components, not all 1,200 pages. Going to explain how Ryan Care changes that, addresses that, what it keeps the same, what it changes, and they're going to explain what Rand Paul and the hard-right conservatives have a problem with regarding Ryan's plan. Welcome, of course, to thejewishnewschannel.com and, of course, to Matzav. We thank Matzav for all their help and support. Let's begin by saying that certain things are just not going to work. And what people are trying to accomplish here, especially the liberals and the centrists, it just can't work on paper. It's just mathematically not possible. They essentially want two things. They want everybody to be covered, even the people who can't afford to be covered, and they want people with pre-existing conditions to have guaranteed coverage. And they also, by the way, they want to be able to afford this stuff. They want to be able to have some of this stuff paid for. Now, that was what Obamacare was out to do. And that's what President Trump also has said he wants to do, which is where we run into problems, which we'll get to shortly. But numbers-wise, that does not work. And everybody knows that. It's basic math. You cannot cover everybody, even the people who cannot afford it, unless somebody foots the bill. Somebody has to pay for these people. 25 million people, 20 million people who have coverage, who can't afford it. Those numbers don't add up. So somebody else has to pay for it. So the answer is you redistribute the wealth. You can be for or against. Well, Yaakov, you're being cruel here. How can you just not want to cover 25 million people? They need coverage. People who are sick, who weren't covered before they got sick. How can you not cover that? I can make strong arguments why you should not cover those people, or at least they should have limited coverage. But I'm not even going to go there. Maybe you should cover them, but don't act like you can cover them and still afford health care. Those two things cannot go hand in hand. You want to cover them, fine, but just recognize that it's going to cost everybody else boatloads of money. That's a fact. There's no denying that. That's the main problem with Obamacare, the redistribution of wealth. Obama and the liberals, they're not even hiding that fact. I mean, they can't. It's just, it's not negotiable. It's not debatable. Now, so that doesn't work. Now, and that's where we have a problem here, is President Trump said, repeal and replace. And I'm a fan of President Trump. And I think he's a million times better than a lot of the other options. But he said repeal and replace, and he was voted in for that reason by the working class, who are being crushed, including you and me, probably being crushed by the insane, exorbitant price of healthcare. And yet, what does he say? He says there are two provisions in Obamacare he's going to keep. We're going to keep everybody covered, and we are going to cover people with pre-existing conditions. Well, hello, I have news for you. Repeal and replace doesn't help if you keep those things, because it still means that the costs are going to be astronomical. Somebody has to pay, whether it's raising taxes, whether it's subsidizing, whatever you want to call it, whether it's expanded Medicaid, whatever you want to call it. Somebody's got to pay for these people. The doctors aren't going to not get paid. Insurance companies certainly aren't going to not get paid, so somebody has to get paid. That's where we're into the problem. But now let's get to the specifics. Obamacare had two goals, as I said. Number one, cover everybody. Number two, cover people with pre-existing conditions. Now, how does it do that? There are 5 key components that really accomplished all this stuff. Number one, Medicaid expansion. They made this enormous Medicaid expansion. Medicaid is much bigger. And of course, that came from tax dollars. So that's going to cover a lot more people. Number two, that's number one. Number two, raising lots of taxes. All sorts of different taxes on pharmaceutical companies and on a lot of companies and other sorts of taxes. So somebody's got to pay for it, right? That's what Democrats do. They raise the taxes. Number three, the individual mandate, because you need to have everybody covered. There are a couple of reasons for this, but that's component number three, the individual mandate to make everybody have coverage. Get back to that in a second. Number four, pre-existing conditions. The insurance companies are now forced to cover people with pre-existing conditions. That was part of Obamacare. Again, that's the goal. And number five is he made the exchanges, the health exchanges. The health exchanges did a few things, but mainly that was how the government sort of intervened and said, all right, we're going to take over a large chunk of the healthcare process because you're going to sign up with us. We're going to basically pay a lot of the money. we're going to subsidize it for all the people who can't afford it through the exchange, and then we're going to sign you up. And the exchanges cause, if anyone's ever dealt with them, cause all sorts of enormous issues with red tape, added costs, and everything else. Those are the 5 components. Medicaid expansion, lots of new taxes, individual mandate, pre-existing condition coverage, and the health exchanges. Now, the reason you need the mandate is, number one, because it forces all the younger people who aren't interested in healthcare coverage, it forces them into the pool. They then are paying their premiums, and that's going to go then and cover a lot of the poor people. Now, conservatives say that's not fair. You can't force anybody to do that, and it should have been proven right by the Supreme Court, except for Chief Justice Roberts, who I don't know what he was thinking. But that's one reason for the individual mandate. The other benefit of the individual mandate is pre-existing conditions. In other words, the problem is that it makes no sense to cover people with pre-existing conditions. The whole point of insurance is a person gets in car insurance, any kind of insurance, house insurance, home insurance, something catastrophic may happen, and you get insured. You pay a lot of money. Everybody pays a lot of money, and or some money. It adds up to a lot. I mean, you pay a lot for all these insurances, but it adds up. And then if something happens, chas v'shalom, then the insurance company has the money to cover it, right? That's the basic concept. If people say, well, listen, the house already burned down, now let me have insurance, or the car accident already happened, now let me have insurance, that makes no sense, right? Then nobody's going to buy into the insurance because they'll just get covered after the fact. It makes no sense. But that's how it works. That's actually how it works with medical insurance. Pre-existing conditions, pre-existing conditions being covered means that a person gets sick and then suddenly buys into insurance. So you need the individual mandate, basically force everybody to have insurance, and then that kind of rectifies the problem of pre-existing conditions, which would be nice, except that you can't force people to have insurance constitutionally. But that's the concept. Now, the raising of the taxes and the Medicaid was a huge component of Obamacare, and just a terrible thing because it crushed everybody. The premiums are still sky high, at least for most people, for many people, maybe not for the ultra poor people. But now they raise taxes on us as well, and at the same time, they're covering all these other people with our tax dollars, which is Obama's dream of redistribution of wealth.